Do you support that policy? Will you prohibit the use of aborted fetal tissue in NIH research, NIH-funded research?
Senator, I'll absolutely follow the lead of Secretary Kennedy and President Trump on this. Just very quickly, may say why it's so important that we have alternatives. Because during the pandemic, I would often be on Catholic radio, and people would ask me whether the mRNA vaccines were made or developed with fetal stem cell lines. And I had to say yes, and they had a lot of the folks who were calling in had ethical objections. In public health, we need to make sure the products of the science are ethically acceptable to everybody. And so having alternatives that are not ethically conflicted to fetal stem cell lines is not just an ethical issue, but it's a public health issue. We need to make sure that everyone is willing to take the kinds of progress that we make, and so I'm absolutely committed to that.
Hey everyone, welcome back to Hot News Today. Tired of the same old sound bites? You're in the right place. Today, Senator Josh Hawley grilled a Trump-backed nominee for the NIH. This was a turning point in the conversation about ethics in science and public health. Senator Hawley asked if the nominee would follow Trump's policy to ban the use of aborted fetal tissue in NIH-funded research. The answer? A firm yes. Ethical alternatives aren't just a moral issue, they're a public health issue. Millions have ethical concerns about vaccine development which can't be ignored. The Big Pharma question. Next up, maybe the most explosive moment. Hawley brought up Big Pharma's influence. The nominee didn't dodge. He acknowledged it head-on. He backed cutting off NIH funding for researchers with financial ties to pharmaceutical giants. Just science serving the public good. Hit that subscribe button and turn on notifications so you never miss an update like this. Then things got real. Hawley brought up the now infamous proximal origin paper, the one that claimed COVID-19 didn't come from a lab. Even the co-author admitted under oath he had no evidence. That paper wasn't science, it was propaganda. It silenced dissent and censored experts. He pledged to make NIH more transparent and accountable.
Can you comment on that? Do you support that effort? And can you comment on the importance of making sure that what we're doing with our NIH funding is prioritizing the health of Americans, not the profit of any particular corporation?
Senator, I think the transparency in conflicts of interest is fundamental to trust in science, and I absolutely committed to making sure that transparency is at the center of the work supported by the NIH. I also commit, Senator, to, and I mentioned this earlier, to supporting research on products that are already off patent, that don't necessarily have a drug company behind it, but that could have potentially enormous benefit for treating chronic diseases or preventing chronic diseases. I think the NIH ought to be doing research in support of the public good, not just parochial research in support of a few companies.
Fantastic. I think that's so important to restoring the sense of credibility and trust that the American people frankly have lost in the NIH and much of our public scientific apparatus.
This is what it's all about. Restoring the public's trust. The American people have lost faith in our public health system. Cozy ties to Big Pharma, lack of transparency and pandemic censorship have shattered confidence. The nominee understands this. Restoring trust is vital to science's future. We need real reform and courage. This nomination might be the first step. So there you have it. Senator Hawley and the Trump-backed NIH nominee could reshape American science and public health. If you believe in ethical medicine and transparency in research, this is a moment to watch. Smash that like button, drop a comment, and subscribe for more. Stay informed, stay bold, and never stop asking questions. Peace.